our gynecologists have specialised in the major breakthrough treatments that are currently available in using lasers in treating what are often very common but very difficult to treat gynecological conditions for which conventional medicine hasn't got particularly satisfactory treatments. Now, in particular, we have used the lasers in treatment of a form of incontinence where there occurs bladder leakage. In other words, women need a pad because they leak urine involuntarily after certain stimuli. The control of the bladder is controlled by the muscle strength of not only the bladder wall, but also by the muscle sphincters that control the mechanism of release of urine, and to a certain extent it's controlled by the vaginal tissue that supports the base of the bladder. Now, in stress incontinence, what happens is with minor increase in pressure inside the bladder, which can be caused by such simple things as laughing or coughing, certainly jumping, skipping, running. A lot of women will leak some urine involuntarily, and conventionally there is no very good effective way of treating that. There are also other conditions of incontinence such as urge incontinence and mixed incontinence. The lasers are found to be very good in treatment of early stress incontinence and of early mixed incontinence. Now, the reason that these lasers work, and they're used in 3 other aspects of common gynecological problems, but essentially their mechanism of action is the same in each, and that is that the lasers will strengthen the support of the vaginal tissue. So what they do is they create a thickened, stronger, more circumferentially firm vaginal wall by increasing collagen production and by increasing the health of the interstitial vaginal fluid matrix between the collagen fibres, so that the vaginal tissue is more rejuvenated to a younger state. Stress incontinence and mixed incontinence is extremely common in women who have had childbirth, particularly multiple children, as they age and the vaginal tissue becomes weaker. The laser treatments are a simple series of 3 treatments, generally 1 month apart. They're quick and easy. There's no need for local anaesthetic. There's no discomfort or pain whatsoever. There's virtually no risks, no aftercare needed, and women can resume normal sexual activities within 3 days. How they work for treatment of stress incontinence, if we look at the side profile of a woman's pelvis, the bladder is here, the floor or the wall, the bottom layer of the bladder is down here, and it shares in common a structure with the front of the vagina. So this is the vaginal tract, this is the vaginal wall that's here, and you can see the floor of the bladder shares a common area with the anterior vaginal wall, it's called. And what the laser does is it strengthens, thickens, structurally supports the whole vaginal tissue. So the framework, the thickness, the elasticity, the collagen strength improves. And instead of the bladder, the bottom floor of the bladder wall sagging down into a lax vagina, the vagina now is structurally able to support the bottom floor of the bladder better. So the sphincter arrangement at the bottom of the bladder is improved, the structural anatomy is realigned, if you like, and it's an excellent treatment for stress incontinence. Now, here at the George Street Gynecology Centre, we've done quite a number of females suffering from early stress and mixed incontinence, and we're finding that most of their conditions are improving significantly even after the first treatment, and certainly by the time they've finished the 3 treatments. Maintenance treatment will always be necessary, and that's a natural part of ageing. We expect the thickness, the strength of the vaginal wall to become looser and more stretched and less supportive of the bladder wall as we age. But the beauty of these laser treatments is they're non-invasive, they're quick, there's no discomfort, they're easy to repeat, and maintenance treatments again only take 10 minutes. We expect these treatments to be done initially 3 monthly, then eventually 6 monthly, and then eventually 12 monthly. Now, the beauty of the treatments for this condition of stress incontinence is it also has a big part to play in prevention of menopausal conditions, which also are affected by the changes caused by ageing to the vaginal tissue. Now, here at the George Street Gynecology Centre, we're conducting a major research and development grant and a long-term investigation comparing the 2 different types of lasers that are used in gynecological medicine. One is a carbon dioxide laser, the other one is an erbium YAG laser. They're both very different lasers. So far our results show that they both produce very similar results. We're the only clinic in Australia that actually has both lasers, and our 4 gynecologists are using those regularly, and we're doing a careful study to find out if one is superior or more effective than the other. The other important thing about treatment of stress incontinence and mixed incontinence is if we get it early, we can prevent some of the surgical procedures that are often necessary with severe and advanced stress incontinence and mixed incontinence. There's a surgical procedure in severe cases where the bladder wall, the bottom of the bladder wall, needs to be supported with a surgical procedure which actually puts a tape underneath the bladder wall, so we have to insert the tape between the bladder wall and the vagina and attach to the side walls of the pelvis to physically hold the bladder up. And that's a popular but very expensive, very invasive procedure that's been done for a number of years now, but it carries certain risks, and more recently a lot of these surgical tapes have had to be removed surgically because of complications. So the important thing is to try and address these symptoms early, where we can get symptom relief and a treatment, and again hopefully prevent the need for further invasive surgical treatments that may be necessary if these symptoms and problems progress without early intervention.